Good morning, everyone. My name is Caitlin, and I am an MIT grad from 2016, also a Legatum Fellow. So let me ask you guys a question. What do a stroke patient, someone with a heart attack, someone who's been in a road accident, and a mother who's gone into preterm labor have in common? It's either someone's worst day, or it's the reality that we deal with in most of the world. And so what if I told you that the greatest chance of their survival is fast care? The shorter the time it takes them to get to the hospital, the more likely they are to survive. But in the majority of the world, there's no 999 or 911. In the US, it's 911, here it's 999. And in Africa, where we operate, more than 95% of the continent is without 911. That means that you're 10 times more likely to die if you're in a car accident, if you go into preterm labor, if you have a heart attack. And so let me tell you a story. So close your eyes for a second. I'm not going to do anything weird, but I just want you to visualize for a moment. So imagine you're in a hospital. You've already seen 100 patients today. It's 1 p.m. Your stomach is growling, and you decide, I'm going to sneak out and go to the canteen and grab lunch. You hand over the file to your nurse who's in the room, and you exit. You dash through the waiting room of the A&E, the emergency department, and you catch the eyes of someone who's curled in the corner and is sweating. He's clenching his chest. You have this moment of fear. You've never actually treated a cardiac patient. It's been 5 years that you've been a physician and you've treated thousands of patients and you've never seen someone survive a heart attack. But you're also excited. Could you actually be the first physician in this hospital to save someone with a heart attack? So you can open your eyes. The rest of the story is that that doctor called us. That doctor called Flair. We had met just a couple weeks prior, and in those moments of fear and excitement, we were the only people that she could think of to call. And that's what most of you probably do today. Is if there was an emergency, you call 911, you call 999. You have a number, you have a person. And the point of that story is, one, is all entrepreneurs tell stories. So now you guys know why we do what we do. But the reality is that sometimes health solutions can be so simple. A 3-digit number, and that saved that individual's life. We were able to evacuate him 3 hours away to the nearest cardiologist, and he lives today. But also, that oftentimes, if you don't have basic systems and infrastructure in place, you have no idea what your health system looks like. When only 1 in 10 actually use an ambulance to get to a hospital, that means that you never see cardiac patients, you never see stroke patients, because they never make it. And so when we think and design for places like Kenya where we operate, we think about it at a systems level. How do you build digital systems and infrastructure that actually allow you to better understand what people need and where they need to get to? So I graduated in 2016, and for the last 3 years, we have been heads down, based in Nairobi, Kenya, building the future of 911. It wasn't a question of let's develop, 911 is a tried and true system. There's no lack of data to show that 911 is an incredibly valuable system, not only for your peace of mind, but to save individuals' lives. So we now have a network of ambulances that is 5 times as large as London's ambulance fleet. We have the fastest response times. We took them down from 3 hours. You could basically walk the city of Nairobi before you got an ambulance. And now we're on scene in 15 minutes. So it's not too bad. So I guess when we think about innovation, or how we think about it at Flair, it wasn't so much the why. Everyone can pretty simply understand that 911 is an essential system for every city, every country, every nation. But the question was how? How are you going to build a system that took the UK 30 years, that took the US 40 years, and that continues to cost billions of dollars every single year to maintain? So how are we going to do it? So the first step was technology, is that we have built a technology that puts every single ambulance on the same system. Think of it like Uber for ambulances. People use that phrase all the time, but it is a little bit like that, is that ambulances now instantly plug into our system. Whether it's government ambulances, whether it's private ambulances, it doesn't matter who it belongs to, but it now becomes part of our network, meaning that when we get a call into our dispatch center, we know exactly where the nearest available resource is. We don't have to waste hours trying to figure out who's going to respond. The second is partnerships. We've done this all by never owning an ambulance. All of the ambulances are from hospitals. We're sitting in parking lots. The irony of the situation, and I know that we were talking a lot about resources, is there's actually enough ambulances. They're just not part of a system. And so we leverage all of the paramedics, EMTs, operators, ambulances that already exist in the system and put a highly fragmented market together in one simple solution. And the last is through financing. For anyone who knows emergency response, financing is at the core. It's the dilemma of all dilemmas. If you get a phone call into our dispatch center, do you help someone if they can't pay? In the US, you get a bill later of $2,000. In the UK, NHS supports it, but that's always a pain point. And so what we do is we also similarly have a subscription model. So much like subscribing to your phone bill or subscribing to water, you subscribe to our services so that if you ever need an ambulance, you can call us and you never pay anything further. And the brilliant thing about that is that everyone will require, not to put fear in everyone's mind, but everyone in your life will require an ambulance. But in those moments that matter most, you just want that help, and you don't want to think about payment. And so that's what we've resolved as well. So how are we doing? So overall, we look at response times. So in 3 months from launching, we took response times down from, it used to take 162 minutes, that's nearly 3 hours. So from the point of an emergency to when you're arriving in a hospital bed. Everyone has heard, for those physicians in the room, the golden hour, 60 minutes. For some patients, you want to be even faster than that. And we've been able to go from 162 minutes and 69 minutes where you are in a hospital bed, and you're in the right hospital bed. And on scene, we're there in 15 minutes. So we do better than, we like to compare ourselves to other cities and countries around the world. We're faster than the Detroit city ambulances. Another thing that's super important to us, though, is partnerships. What I said is, like, it's not just impact on the patient's life, but it's partnerships for hospitals, for physicians. These are individuals who every single day, like the doctor that I told you about, deals with emergencies, and they have no one to call upon and no one to help. And they have all the right training, but they don't have the right resources to be able to dispatch an ambulance. And so we're incredibly proud of all of the ambulance partners that we work with, as we would not have been able to do what we do without them. And the last thing I'll kind of talk you through, it hasn't been all rosy pictures. It's not as if, we haven't gone through our ups and downs as a company. We've grown tremendously. We now serve the entire country of Kenya, not just Nairobi, and we'll be moving across the region this year. But here are some of the things that we were confronted with when we were starting the business. The first is that the market's too small. You're doing something so niche, they said, in emergency response. The reality is that emergency response, it isn't niche, actually. Everyone, as I said, 6% of the UK population uses an ambulance every single year. It's not small. Every single disease burden will go through a system like that. The other is that where we operate in Kenya, on the African continent, it's the fastest growing continent. By 2030, we'll have a larger middle class than China. And so there's so many people that could benefit from some basic infrastructure that we've built. The other is that people will struggle to access through mobile phones. So all of our systems are cloud-based mobile phones. We did away with the UK and US system of landline tech. And the reality is, again, that's not true, is most people have cell phones. And the last one, which is an interesting one to end on, is that ambulances should be public. Everyone always says they're run by governments. The reality is even NHS and every single emergency response system across the globe is a public-private partnership. And we fully agree. There is involvement in the government, and so we work very closely with the Kenyan government to support policies that will enable us to grow. So the last thing is join us. If you took anything away from this presentation, is to know that emergency response will affect everyone. The majority of the world does not have a 911 system. So whether you're in academia, whether you're an investor, whether you're someone who wants to come work with us, join us.